All right, Doug, are you ready to get going?
I think so. I'll keep letting folks in while you intro, and then you can hand it over to me.
Great, excellent. Well, thank you everyone for coming and taking the time to attend today's training. I'm Stephanie Dahlberg here with the Bureau of Housing Supports at the Department of Health and Human Services. I'm also the co-chair of the Balance of State Continuum of Care Coordinated Entry Subcommittee. The Balance of State Continuum of Care is sponsoring and hosting this training series with continued communication and collaboration with our other two continuums of care, Greater Nashua and Manchester. We're here today to talk about the roles and responsibilities within the New Hampshire Coordinated Entry System. This training was developed and will be presented by the Technical Assistance Collaborative. The training will be an overview of roles and responsibilities, understanding there may be some funding specific requirements and details that aren't fully touched upon during the session. Our following sessions will give more in-depth information for what's required for each grant, but we will touch on some of it today. I also wanted to point out that there are a couple of distinctions when we're talking about coordinated entry. So there's the coordinated entry system, which is the main focus of our training series. But there's also the coordinated entry grant that's funded through HUD and the coordinated entry project in HMIS for data. So again, we're really focusing on the coordinated entry system, which incorporates people from all different sorts of backgrounds, don't necessarily need to be funded for housing projects. We're looking at the whole system here, but we will touch on the other pieces that are part of it. We appreciate you taking the time to be here with us. And you may have seen in the chat, we do have a link for sign-in. If for some reason you can't access that, you can email me, and my email is also in the chat. And with that, I'll pass it over to our presenter, Doug.
Thanks, Stephanie. And Stephanie, if you could take keep an eye on the participant list coming in of folks, if you can let them into the room, that would be great. Welcome back, everybody. We are recording this and the slides will be available. We also anticipate questions coming up today. The overview that we're going to discuss is probably information that you've seen in different places. And so we're trying to kind of get that all into the same place and talk about some of the various roles and responsibilities based on the type of partnerships that exist within New Hampshire's coordinated entry process across the state. My name is Doug Tatro. I'm with the Technical Assistance Collaborative. We are a TA and training provider that is based out of Boston. We're hired by HUD and VA and states and localities to assist with homeless services and design. I'm actually based in New Hampshire. I live in New Hampshire, which is nice because we do work in different parts of the country, and I have an opportunity to work in my home state in this regard. So today we have a 90-minute session scheduled with some time that we're hoping to reserve for the end for questions. You can feel free to use the chat for questions that are popping up so that Stephanie and her counterparts can take a look at those throughout the presentation. I'll also ask Stephanie or others if they need to chime in or clarify anything that I review because this is specific to your system and there may be some nuances that need to be added in here or there, or we can get to those at the closing. First things first, please feel free to click that Google link in the chat to let us know who is here. That will be the attendance of record for this training. You can put your name in the chat as well, but that will not be recorded as attendance. What we're going to do today is first go over very briefly a couple of slides that we discussed in our first session last month around what is coordinated entry overall. That will be a very brief recap for everybody in case you missed last session. If you did miss the last session, the recording should have been made available, and if not, we can get it to you because I think that session is really important, just sort of level setting for everyone to have a good foundation for what we're talking about when we talk about coordinated entry in homeless response systems. And then we're going to talk more specifically about the responsibilities and the timelines associated with those responsibilities for the different types of partners on the phone, whether you're an assessment partner or a housing provider or shelter provider. Some of you will be all of those, some of you none of them, but we'll talk a little bit about that. And then if time at the end, certainly we'll have questions, and we are recording the chat as well. So if there are questions that can't be answered or that the folks in leadership need to go back and discuss, we can follow up at a later date on those. So as a general sort of lead into how the responsibilities operate here in the state of New Hampshire, we just wanted to give a very brief recap of some of the information that we went over in our first session last month. What is a continuum of care? So a continuum of care, the idea of the continuum of care was first established by HUD in the Hearth Act, and there are minimum requirements for how continuums of care are structured, how they're governed, and how collaboration between COC-funded projects, so projects that are funded under HUD's annual NOFA for the COC program, and the Emergency Solution Grant projects are managed and coordinated to create a system that is designed to most effectively and efficiently address the needs of homeless individuals and families within the geography. So the COC is really this compilation of all stakeholders who are interested in ending homelessness within a given community. And I think some of you, if not many of you, are service providers that may not even receive HUD funding. And so the question about whether or not you're part of the COC comes up. And from HUD's perspective, and I think the perspective of what we're trying to accomplish here, is that while HUD only requires that HUD-funded projects participate in this continuum of care process, the ideal world is that all service providers, housing providers, outreach providers within a given geography and in the state across New Hampshire are working under sort of the same set of parameters and policies so that those services can be integrated as best as possible. So this includes all of you on the phone would be part of what we might consider this group of interested stakeholders, representatives from relevant organizations across the spectrum of services for homeless or at-risk individuals and families. So when we are talking about the COC, many of you and some of you may think, well, the COC is the state, or the COC is this entity in Manchester or Nashua that runs the show, when in reality, what HUD is trying to achieve, and by sort of extension we are, is a system where the stakeholders like yourselves are contributing your expertise, your services, your priorities to shape how planning and action is done relevant to homeless services throughout the geography. So the COC is that full body of stakeholders. And while there are leadership structures in place and entities that are doing more of the day-to-day work or putting pen to paper more often, all of you are empowered to be part of this continuum process and informing the strategies and priorities that the COC is undertaking. And there are 3 continuums in the state of New Hampshire. There's Manchester, Greater Nashua, and the balance of state. We're going to talk today sort of about those 3 COCs kind of operating under one kind of general umbrella, but there are distinctions amongst them, and the nuance of that we can get into at a later date. But you are all part of that continuum of care planning body. And the COC as a whole, often designated through leadership, has some primary functions that basically to operate the overall system for homeless services within a geography, to ensure that there is a designated HMIS lead and HMIS implementation for the entire geography, and to conduct the planning conversations and action steps to employ strategies that are most effective in trying to get toward that goal of ending homelessness. One of the primary operating sort of duties of the continuum of care is to establish what we call a coordinated entry system. And as Stephanie alluded to, there are different buckets of terminology that we might use to talk about coordinated assessment. There are the coordinated assessment or coordinated entry grants, which are specific funds from HUD that go through what we call your collaborative applicant to operate coordinated entry processes. There are HMIS data elements relative to coordinated entry. But by and large, what we're trying to do is, and within the context of this training, stand up a system where we are able to identify those households who have the greatest level of vulnerability, who are in most risk of either continued homelessness or of bodily harm or death, or bad experience in homelessness, and make sure that our resources and our efforts are targeted toward those households who may have that higher level of vulnerability, while also coordinating services, referrals, and lighter touch interventions for those who may not qualify for or may not be able to access a longer term, say, permanent supportive housing voucher or rapid rehousing voucher, but we are working in a coordinated way as across the system. So part of the requirement is that a continuum of care, that larger group of stakeholders that many of you or all of you represent, is establishing a coordinated assessment system that provides this initial and ongoing assessment of needs for individuals and families, that covers the full geography, and that is really accessible, proactively accessible to individuals and families that may be seeking assistance or need assistance. And when we talk about coordinated entry and assessment, this is not just a tool, but in fact a process that employs different types of tools and interventions that are meant to divert folks or prevent them from becoming homeless, providing initial emergency services if they do become homeless, triaging individuals of varying needs to resources that may meet those needs or that they may need, but also recognizing that we are in a finite resource environment. And even with all of the infusion of resources coming out of the COVID stimulus bills, we still operate in an environment where the amount of particularly longer term intensive assistance like permanent supportive housing combined with a lack of affordable housing constrains how many households who may need that level of assistance we can actually have access it. So coordinated assessment allows us and empowers us to try to work with folks at varying needs and goals within their housing path and stability to try to link them with a resource or some sort of service that gets them to exit homelessness as quickly as possible, while recognizing that those who are most vulnerable, who have been homeless the longest, who have the highest level of disabilities or housing barriers, are those that we need to target our more finite resources to. And that is the impetus behind requiring this assessment system. So this is meant to be a system-wide approach where we're employing these different types of interventions as a whole. So from prevention to diversion and problem solving and other creative approaches, to making sure that our programs are operating within the flexibility that they have and using shorter term interventions like rapid rehousing to supplement where we have pitfalls in our permanent supportive housing portfolio, making sure that we're not continuing to use a first come, first serve approach. We have used first come, first serve approaches for a long time in homeless services, and that is inherently inequitable and wasteful in terms of the finite resources that we do have to work with. And what we're trying to do is create what we might consider to be an emergency room triage, where if somebody comes in with a broken arm, under a first come, first serve approach, they are going to be served immediately, even if someone 5 minutes later comes in with significant head trauma. What we need to reorient our system to be in this emergency response is making sure that the person with head trauma, the person most likely to suffer the most adverse effects based on their unique vulnerability in the moment, is served in a way that reflects not the timing by which they entered our system, but the vulnerability that exists in their lives and their morbidity toward as a result of their homelessness. So our coordinated entry process as a whole, it tries to reorient our system to be client driven, to be housing first, to employ client choice, but also to recognize that there are some households for whom homelessness is far more dangerous or far more prolonged without access to our services than other folks may see. So this is a generic, screen of what a coordinated system looks like, where we have folks who are living in the community in housing. Some may be doubled up, some may have their own housing. With COVID, we saw a changing dynamic in who was losing income and therefore losing their jobs. There is a coordinated entry access process, and we're going to talk about some of those points today, where diversion and problem solving is employed, and we're looking to find ways to have folks avoid that literal homelessness, even if that is less than ideal, as long as it is safe. looking for ways to reduce the trauma of folks actually having to live on the streets or in shelter or their cars or the woods, and trying to find alternatives. Where those alternatives can't be immediately identified, we're ensuring that linkage to emergency shelter or services, and then beginning and continuing to assess those households and working with them to understand their goals and needs based on their own sort of glide path out of homelessness, to connect them with a resource that may be available to them that can end that homelessness. The reality, again, is that there are many people in the state of New Hampshire for whom a resource will not be available due to the lack of enough resources, and we need to continue to employ these more creative solutions as we go along to try to find other ways that we can help people mediate or navigate their ways out of their homeless crisis, knowing that many of the longer term resources are occupied by folks who have been either in instability or homelessness for quite some time. So these are the core elements that we're going to talk about over this training series that we started to introduce last time. Access to the overall system, so we can't help people that we don't know are there, and it's not their job to find us, it's ours to find them. Assessment, which is not a single tool, but a process that allows us to understand the unique goals, desires, and needs of an individual household or family in order to link them to what resource may be available and appropriate to them. Recognizing that we have a finite resource environment, and while many households may need rapid rehousing or may need permanent supportive housing, we may not have enough of those resources, so we have to further prioritize based on the vulnerability of the population that we're serving. And then referral, making sure that as folks are prioritized for a given housing slot or enrollment, that we are seamlessly moving people toward that provider or that enrollment to get them off the street back into housing and hopefully back into some level of stability in their life. So the rest of this, that was my brief recap. Coordinated entry overall for those of you that missed it or needed that refresher from last month. The rest of this presentation is going to talk more about the New Hampshire coordinated entry roles and responsibilities that are laid out within the coordinated entry manual and some of the partnership agreements that have come out. I would encourage folks to use that chat for questions as you need it, or you could follow up with us later. But we're going to dive into that here. So some high level points. Stephanie mentioned that coordinated entry, and many of you may not be funded by HUD. There is no requirement, regulatory or otherwise, that if you do not receive HUD or VA funding, because the SSVF program and HUD-VASH programs and GPD do require use of coordinated entry as well. But if you're not funded by these federal homeless resources, you may not be mandated to participate in the coordinated entry process overall. But the state of New Hampshire and the 3 COCs within it are committed to working with all types of providers, whether you're funded by HUD or not, to try to integrate our services in a way that brings that system level approach with common goals, common practices, and common protocol for how people move from a level of homelessness or housing instability toward hopefully not being homeless anymore, whether that requires a longer term resource or not. You also may be a provider that wants to participate in coordinated entry, but you don't have the capacity to complete all of these expectations that we're going to talk about throughout this presentation. And from the balance of state perspective, certainly, the state is willing to work with any provider, whether you're a small shelter or a transitional housing project, or you provide affordable housing that primarily goes toward people who have experienced homelessness, or you're doing outreach services through a faith-based organization, whatever it may be, you may be very constrained in your capacity to meet, data entry or timeliness needs, but that does not mean you can't be a partner in this work. And so we would encourage folks to continue to the dialogue with your continuum of care leads, with the state and the balance of state, for instance, to figure out where you might fit a niche and where your services may be able to complement what's happening within the sort of formal coordinated entry process, and where the formal coordinated entry process can help complement the services that you're striving to deliver to your clients. We also want to make sure that it's exceptionally clear that coordinated entry fully embraces client choice. So the idea here is not that we are dictating the type of housing, the location of the housing, with whom people live in that housing, in order for people to access services. If there are folks that are unwilling to provide information or documentation, that does not preclude a household from being part of this overall service delivery system. It may delay, in some respects, the housing options that exist because there are certain documents and personal information that needs to be disclosed for enrollment. But we are always looking not to, sorry, one second, I gotta put another headphone in. We are not, Stephanie, can you still hear me?
Yes, sir.
Okay, I'm sorry. That we are not looking to dictate that, but we are using the client's choice as part of what informs us in how we make these referrals. So for a long time, we've run programs, right? And frankly, many of you are still running programs that are not integrated into a system. And what we've done for decades now is we've run programs that are disconnected from the larger goals in a given community, and we haven't ended homelessness. And that's not the only reason. We have an affordable housing crisis, we have a pandemic, we have the same level of funding every year for higher costs, but the way in which we've seen community level goals be achieved is when we work as a system and work within a coordinated approach to allow each of our skill sets, each of our expertise, each of our project design to be consistent with the larger goals at hand, and to meet the niche that you may have as a given expertise or different project type. So we have to adapt. We need to stop thinking about households as our client, but I'm sorry, my client instead our client. We have to start realizing that across a community, there is so much good work happening that it often can get muddled in a way that becomes duplicative and counterproductive when we're all trying to do the same thing at once and we're missing key gaps and maybe missing key services for folks. So the goal here, beyond HUD's sort of overall requirement and the typical federal regulatory language that comes out when these laws are written, is that we're trying to create a homeless crisis response system that can best meet the needs of the local population that need those services, while also doing that with the optimal amount of efficiency that we can, again, as a community of practitioners. So that is our goal. So what we're going to do for a little bit, and Stephanie, feel free, if there are questions, if you want me to pause, I'm happy to. I can't look at the chat while I'm speaking.
Don't worry, I'll flag you down.
I do see some flashing. All right, you can go ahead and flag me down. Thank you. So what we're going to do now is we're going to talk about the different roles that are articulated as part of the Coordinated Entry Guidebook and the partnership agreements that have been put in place and that many have seen, starting with the Coordinated Entry Lead. This is the entity that some of you may call the COC. And I don't really care what you call it, but just for distinction, the Coordinated Entry Lead is a specifically funded or operated entity that is responsible for facilitating and managing the coordinated entry system within your specific geography. So you can see down below the 3 New Hampshire COCs. So for Manchester, there's a coordinated entry committee that is convened by the Continuum of Care and its governance charter. In Greater Nashua, Harbor Care is your coordinated entry lead. And then for the rest of the state, outside of the Greater Nashua COC and Manchester COCs, the balance of state, as it's called, the New Hampshire Department of Housing Supports, is your coordinated entry lead. So the state assumes that responsibility, and they are also the collaborative applicant. These entities, in general, are the ones that are responsible for the ultimate matching of applicants based on their assessment, based on their trajectory and eligibility, to the available prioritized housing providers that have openings. They also are going to be maintaining and updating the regional access points, some of the inventory lists, sending out updates, providing training and support. So your coordinated entry lead is really a navigation sort of role, both for the end result of the housing referral from prioritization, but also in terms of bringing together groups like this to work toward policies, protocols, and priorities that are meeting the community's needs. And so there's a convening power relevant to the process of how someone goes from becoming homeless or at risk of homelessness to either avoiding that homelessness altogether or being rehoused, whether through a dedicated resource or not. So in this context, the court entry lead is really focused on that local prioritization list, the list of folks for whom an assessment has been conducted, diversion and problem solving efforts have been made and have not been successful. The household is now in homelessness, is unable to escape homelessness on their own, or at least for what we know at the moment. And there are housing providers and openings that are opening up, and the court entry lead is making that linkage from that list of those individuals who are prioritized to the available housing for which they are both appropriate and eligible for. So those are your court entry leads. They are also here for that training and support. So this discussion here is being hosted by the New Hampshire Bureau of Housing Supports under Stephanie's leadership and others. I'm helping out a little bit here too as the presenter. But they are a convening entity and a coordinating entity as much as they are also playing that administrative role of developing policies and procedures, making sure that the roles are clarified for different partners and things of the like. So that is your court entry lead. We're going to go amongst the different partnerships now, who you are, what your general responsibilities are as part of that partnership. And for those of you who are not part of any formal agreement within coordinated entry, maybe wondering, what does all this mean? We're going to get into a little bit more of the detail now. So one of the first and largest sets of partners that we have here are our referral partners, and that's how we're going to refer to you as referral partners. You are individuals that are able to make those referrals. The list is here. I'm not going to read all of these, but if you're from any one of the organizations listed on the screen at the moment, the next 7 or so minutes of the slides will apply to you. And these are folks that have signed on to or committed to being what we're calling a referral partner within the coordinated entry process. So if you see your name here, the slides will go out if you can't read it fast enough. The next slides apply very specifically to you, but everybody should be listening because, again, we're creating a full system and we need to understand how different parts of the system work. So the primary role of the referral partner is someone who is referring or connecting households with the regional access points and assessment partners. So you may attend case conferencing sessions, but you could be a hospital. We saw some SAUs listed, schools, community organizations, other providers that may not have HMIS access. For those of you out there, HMIS is the Homeless Management Information System. It is the central database for how we manage homeless services and data throughout the continuums. Restaurants, coffee shops, really any community provider that may encounter or interact with homeless or at-risk individuals who may need to be referred into or provide information on how to access some of these service centers, like your regional access points, and where those assessments for the longer-term housing needs take place. So there may be an immediate referral to 211 or a local assessment partner who we're going to describe in a couple of minutes as soon as you interact. So this could be casual interaction. This could be in the community, folks that are, you can see here, coffee shops. Maybe there are places within the community where people who are experiencing homelessness are frequenting. And these partners now have the tool or the knowledge that they need to be able to provide information for that folks or referral to that folks that then connect them with the larger formal system of coordinated entry and homeless services. So some referral partners will also be homeless service providers if you're on the list that we showed here. But you can see many of these providers and partners are entities that may exist on the peripheral of the homeless service system, right? So hospitals, cities, the VA, other types of programs that interact with people in the community, some of whom are homeless, some are not, that are maybe the first touch point for somebody who's in crisis and are trying to then connect them to a next step. For our referral partners on the line, if you're on that previous slide or if you're interested in being one, there is no data entry requirement specific to coordinated entry. There is that referral to the local assessment partner or 211, but these partners do not have access to that centralized database It may be a soft touch or one touch type referral that is coming from a referral partner because they witnessed somebody in their restaurant or in the school who has clearly and has unstable housing situation, and they're moving it into the more formal coordinated process that allows those folks to get connected to any available resource that may transpire for them based on their assessment and eligibility. So this is sort of our outer edge of our circle when it comes to bringing folks into our services. One thing that I will mention, if we have anybody who's involved in local YMCAs or law enforcement or other providers like that, there are a lot of people inside our communities. I live in the city of Manchester. My stepfather works downtown in an office, and he interacts with folks that are in downtown Manchester, sometimes not liking the interaction he has, but interacts quite a bit. So, you know, these downtown business districts, the local areas where folks may congregate, especially in some of our cities or larger towns, they can be referral partners and may appreciate having the information they need to connect to somebody who it may be in their area where they work or where they live, and having some sort of phone number to call or that assessment partner linkage so that we're bringing people in. So one of the biggest challenges with access in coordinated entry is that a lot of people don't know where to go if they fall into homelessness or have a housing crisis. And I would say the vast majority of people may know about 211, but you know, I live in Manchester, and I think if I surveyed, you know, 5 or 10 of my neighbors, you know, what would you do if you lost your house today? I don't think very many of them would know what the response would be or where to go. And so these informal, but sort of protocol-driven organizations that are referral partners are really key in-reach and outreach partners for all of us to be able to make sure that anybody who may be in a housing crisis that's not being touched by shelter systems or your regional access points or the outreach teams knows that there are some sort of a linkage to resources that may be available to them. So those are our referral partners.
Really quick,
Yeah.
I see a question in the chat. How are referral partners tracked to see how they're making referrals and to also provide support to those that are very active? So the referral partner role, there's no strict requirements on this. It's pretty open, but if you're referring to like how they make a referral, we'll get into that a bit more, but you know, utilizing the 2-in-1 and developing relationships with the assessment partners is going to be one of the first steps. And again, we'll get into, you know, the how on how that happens as we go further in this training and then our other trainings in the series. But we're working on how to kind of formalize a referral process from referral partner to assessment partner. I hope that answers the question. Let me know if it doesn't. We can always circle back with that. And then our local partners that are required to be part of this process are working in their communities to talk to everybody about what coordinated entry is and invite them to be referral partners. So that's how the referral partners you saw in the previous slide got connected with the system, and they're invited to all these trainings and you know, trying to link arms together to make this work.
Great, thank you, Stephanie. So continue to add those questions if you have more on that or anything that as we go along. We'll take some stops here and there and leave time at the end as well. So our referral partners were that group of formal and informal touch points where folks are getting navigated toward that emergency response and sort of the next steps in our formal system. Our assessment partners play a really critical role. They are listed here. I think we got everybody. Stephanie, if you're not on this list and want to be an assessment partner, more to come. But we have a wide range across the state of New Hampshire of folks who are considered what we call assessment partners. And remember, assessment is a process. We'll talk about that in a moment. It is not just a single tool or a single intervention, but it is a role within the community, this network of service providers that is helping us to understand who is in most critical need of the housing interventions we have available, using both tools and strategies to try to do that. And we're going to talk about that in a second. But if you are on this list, you are considered an assessment partner. It's one of the most critical roles within the community and within the court entry process. And so you can see that list here. If you haven't found yourself yet, or if you're not sure, we will send these slides out. But this is the current formal list of assessment partners. This is really where the point of entry for the formal coordinated entry happens. So you are a point of entry for applicants going into the court entry project via HMIS, and I'll talk more specifically about the HMIS requirements in a moment. These staff in assessment partnerships are trained and will be trained more in the coming months on what it looks like to do coordinated entry assessment processes, both from diversion and problem solving and creative sort of navigation to the more formal assessment tools that some of you have used in the past that are being adapted a bit now. But training will be offered to all of you. Assessment partners should understand that there are tools that are used, but there are also skill sets and philosophies that we apply to the front door of our court entry process that we will continue to support, and the state and the COCs will continue to support you all in the coming months. So more to come on that. But there is an expectation that as you're working with folks and doing assessment, again, as a process, that there's a regular check-in with individuals that are on these prioritization lists that have gone through a basic intake into HMIS, that have now gone through longer form, more formal assessment, that there is ongoing sort of connection with these folks, starting to look at what other options may be available to them if they're not going to be poised for a housing resource immediately, where their document status might be, where referral status might be, other updates to their overall assessment. I would argue that as an assessment partner, one of the key tools that you have is your ability and skill set in helping people navigate toward alternative options other than being homeless, recognizing that many of the people that you're engaging with will not receive a housing subsidy anytime soon, and that we may need to be thinking more creatively about ways that we can help folks connect to landlords, connect to local job markets, or where there may be folks that may be willing to live together, and you're seeing them in your assessment process, knowing that they may not be connected to a dedicated funding source soon, but if they are willing to look for a 2-bedroom unit and live together, and that gives them what they need for to afford their housing. You know, this is really an engaged group that are proactively engaging with the folks who are experiencing homelessness in the community, and they are part of the overall New Hampshire Coordinated Entry Partnership Agreement. If you were on that list and you don't know what the partnership agreement is, you should probably talk to someone else internally or let Stephanie know. But that is an agreement that outlines the roles and expectations that we're kind of reviewing here today. So the overall timeframes are both sort of articulated, but with some flexibility. So one, we need as a country, frankly, to be infusing much more deliberate diversion and problem-solving strategies into every engagement with every client that we see. Just because somebody has multiple disabilities or mental health issues does not necessarily mean they don't have other support systems within their family or social structures or within the community that may help them exit homelessness without needing a longer-term intervention. Similarly, there may be people who present with very few housing barriers or other types of disabilities that we might identify who do not have other options to exit homelessness without our support. So we use diversion strategies, and I know there's a diversion tool that was developed by a number of folks, and including, I think, Mandy Reagan, who's on the line, who would help champion that, that is used to try to identify whether there are alternatives to their literal homelessness tonight, whether there are other creative ways that we can help people navigate away from that system, where we're trying to put the emergency back in emergency housing, where emergency shelter has become the new niche housing intervention in this country, which is terrible. And we try to make sure that those folks who need shelter services, who need, you know, hotel, motel, who are coming into the system, have no other viable options. And that is an area where there is training needed for, I think, a lot of folks across the country, including in New Hampshire. How do you connect with people beyond just collecting basic information and putting them in HMIS, but in fact, really getting to know clients, empowering them to help you identify their glide path and their pathway away from this crisis situation that they're in, oftentimes meeting with them on the worst day or week or month of their life and navigating that really difficult trauma-inducing process that households are going through when they're coming for help. So that diversion conversation, that problem-solving approach, that ability to connect with people, not in an administrative capacity, but in a human capacity, right? Rehumanizing the folks that we're trying to support happens early at the initial point of contact, and often it's an ongoing conversation where we're continuing to work with people to identify ways in which we might help them exit homelessness with or without a longer-term housing resource. Within 14 days of that initial contact or initial engagement, the expectation is that assessment partners are going through the more formal, excuse me, coordinated entry process, or I'm sorry, coordinated assessment tool. The tool right now that is in place came out of the COVID-19 public health crisis, which still persists, and is being adapted to better reflect the needs of the community and to infuse more focus on equitable service strategies and access as well. So that's where that training will come in. But within 14 days, there should be the court entry assessment, which collects additional information, but also helps to prioritize folks based on their level of and breadth of vulnerabilities and housing barriers that exist in their life. The expectation is that there is that minimum weekly outreach to those that are in coordinated entry and documenting any changes of referrals or other services that are being provided, that you are updating and connecting folks if they're no longer contacted for 90 days, and also where possible, working with the client to gather supporting documentation, one, for eligibility into projects in terms of establishing chronic status or disability status, but also trying to assist in other things like getting ID or items they may need for the rental market, even if they're not items that are required by the projects that they're being funded by. So this is where HMIS becomes exceptionally important, and there are some distinctions that need to be made. And Stephanie, feel free to chime in here if I mess this up. I want to make sure it's really clear. There are two coordinated entry projects within HMIS that serve two different functions. What we are trying to do with coordinated entry is first understand what is the total universe of people within the state of New Hampshire for whom housing instability or homelessness is present, right? Where we have a big picture view of all of the people who are engaging with an initial touch point service, initial engagement, seeking services or housing or in a housing crisis. So the referral coordinated entry project, as it's called, is that basic data collection function that allows us to understand the total universe of folks who are experiencing crisis and seeking services within the community. Assessment partners are required to enter or open that case in the referral coordinated entry project within 24 hours of the initial engagement, and as soon as possible is helpful. This is basic data collection that allows the HMIS system to know that that household exists and where they exist, and some basic information about them. Within that 14-day period, you will then do a longer form assessment, which will include, for those you're unable to divert, because again, we're continuing to try to find ways to find alternatives for people. For those that remain homeless or within your system, you're then doing that longer form assessment that includes prioritization, weighted prioritization factors and vulnerability factors. And those folks would be entered into the coordinated entry project. So there's referral to coordinated entry that creates our full universe of households for whom an initial engagement happens. And then there is the coordinated entry project, which then by entering them in the coordinated entry project, there's additional information, additional information on vulnerability and risk. And that then puts somebody into the overall prioritization list that the COC uses to identify those who are going to be referred for the next available project, whether it's permanent supportive housing or rapid rehousing. So within that 14-day period or some version of it, we are going to continue to focus on what alternatives may exist, look for areas where there could be self-resolution, reconnection with family and friends, mediation with landlords. Maybe the landlord told them they were kicked out, but they really weren't, and they still have tenancy rights, and we have to mediate that a little bit, get them back into the unit, and then reconnect back to legal services. There's all these different variations of ways in which we can support people without giving them necessarily an enrollment in the homeless services that, again, are finite. So those two HMIS distinctions are important for folks to understand. But you're also going to be entering interim updates in coordinated entry projects anytime information is missing or updated. That would happen at a minimum every 90 days while folks are still actively homeless. Making sure that information that may be false, so they could have indicated they are a veteran, but that's not true, so you have to correct that. And making sure that if there are any transfers from one region or regional access point geography to another, that's being communicated with the coordinated entry leads, and folks are then exited if they are no longer found after 90 days. We create sort of a 90-day structure to say, if we are actively looking for and have yet to be able to relocate or find Doug, who we saw 91 days ago, we assume that Doug is either being picked up in another region and or Doug has self-resolved his homelessness, or he moved to Florida, or he won the lottery, whatever it may be. From an HMIS point of view, we're going to exit that client and consider them not to be part of our total universe until and if they reemerge later. So these HMIS requirements fall in line with the effort to connect with people, look for those alternatives, begin to understand what their real needs are, begin to understand what their desires and goals are, and then progressively escalate our assessment process to collect more information over time that then put somebody toward the prioritization list. As a point of clarity for folks where a lot of what I'm talking about is jargon, just because a household hits the 14-day trigger, gets assessed and gets put in coordinated entry, is now on the prioritization list, is not in any way a guarantee that that individual or household will then be connected to a dedicated homeless resource. So we have a whole universe of folks that need assistance. A subset of that universe, typically a large subset of it, goes into what we call our prioritization list in this vocabulary, which means they're part of the overall assessment process. But then a much smaller group of that total universe is going to actually have a permanent supportive housing or rapid rehousing slot made available to them, or a choice voucher or something like that that's facilitated through coordinated entry. So just because someone's on the prioritization list does not mean our effort to help them navigate towards some other alternative goes away. And in fact, the more people we can help navigate toward other alternatives, the more opportunity we have to make sure that the people that we are linking to the finite resources we do have are the ones who need it most and are at highest risk of not exiting homelessness on their own. So this 14-day window does not mean we just stop and say, okay, you're on the housing list, sit tight for a little while and somebody will call you with your housing voucher. That is not going to happen. And we have to make sure that we're communicating to clients that when they're going to be linked to a housing resource is unknown. Because again, we are triaging broken arms and head traumas. So if someone even is poised to go toward PSH in the next month or two, but then we have more people with head trauma come in and those folks need that intervention more quickly, then that person who may have been coming up toward a referral, that might change. It can change in real time. It can change in a day's notice. So we are not creating a numerical chronological list of folks for when they're going to get their housing. We need to make sure that clients understand that there is no guarantee they're going to be linked to housing in the near term, and that anything that you all as assessment partners can do and they can do in an empowered way to help resolve their homelessness or find alternatives is going to be important until essentially the day that they are referred into some sort of housing intervention, and frankly accept that housing intervention based on whatever conditions exist, where it is, what the expectations of the project are, and whatnot. So this assessment partner role is primarily an engagement partner role, right? It is understanding the needs and desires of clients, working to contribute the data needed for the system to understand those needs and desires, and supporting clients in trying to resolve the worst day and month and week of their life as quickly as we can, even knowing we may not have a dedicated resource to provide to them. So those are our assessment roles. Stephanie, is there anything that I should pause for, or should I continue?
I just wanted to say really quickly, everybody who's currently part of our formal system is either a referral partner or an assessment partner. And what we're getting into now is kind of some of the deeper details for our assessment partner folks. The other thing I wanted to mention is that we found it important to include some of the HMIS requirements just so everybody in our system has an understanding for what is being expected of each role, but we will get more into the specifics on all the assessment stuff and all of the other requirements as we move forward in this. If you have any really urgent concerns or questions as you're looking at what these are and you're saying, hey, I'm an assessment partner and I'm not sure about this or that, you're welcome to ask us here, but I would also encourage you to reach out to whoever it is that oversees your funds that make you an assessment partner. So I think we mentioned today, and we mentioned at the last training, assessment partners are all of our required partners. That means your funding source is requiring you to participate in this process. So if you have any vague questions, please take it back to whoever it is that is overseeing the funds you receive that make you required as an assessment partner. Thanks, Doug.
Thanks, Stephanie. So 211. So New Hampshire 211 is, as many of you know, and it's probably, I go back to, if I knocked on 10 of my neighbors' doors, how many would know what to do if they suddenly lost their housing or became homeless or had a health crisis and, were evicted or whatnot. I think 211 is probably the vocabulary that the most folks in New Hampshire who have not been experiencing housing instability in the past know about. But this is the main entry into our court entry process, particularly while it's phone-based entry into the court entry system. It's a 24/7 referral for housing needs. And one important feature of 211 is that staff are conducting that prevention and diversion assessment tool, which is a physical tool that exists, but also requires really important skill sets in trying to understand where folks are at, what the most appropriate resource is, where the regional access point is going to be for them to follow up. So that 211 is our triage entity in many ways in terms of understanding where somebody is, what their crisis is, and then being able to connect them in this sense to a regional access point that can continue to follow up. So 211 is a crisis line. So we are trying to make sure that the housing crisis is resolved in the moment, making sure that if somebody is fleeing domestic violence or has been abused, that there's a safe place for them to go, connecting someone to emergency shelter or another provider. If it's a veteran, our SSVF community has hotel motels, making sure that we have a basic capture of what the crisis at hand is and are getting folks connected with a longer term process of our regional access points and our assessment partners moving forward. 211 also has a broader picture in terms of being able to connect people to resources that may be for people who are in poverty or lower income, that may not be necessarily for literal homelessness or risk of homelessness, like welfare systems, child welfare systems, emergency responders, and things like that. So what the expectation for our 211 partners is that they are using that diversion assessment tool, employing those housing problem solving strategies in a light touch manner, generally with an initial context where clients are seeking support, providing the caller with a list of local resources that may include emergency shelter. I believe in some cases, make a judgment call on whether any sort of emergency services are necessary, and then having that referral made to the local regional access point, which becomes sort of our centralized manager of these folks that are seeking assistance that can't be immediately diverted, where the crisis is clearly housing related, and now we're sending that client or that household information or giving them information on how to access the broader kind of homeless crisis response system. So our 211 folks will enter clients into that referral to court entry project. So when you see the word referral, that means we're capturing the full universe of engagement touch points for people in crisis. It does not suggest that they are doing long form assessment. They are trying to make sure that there's no dangerous, urgent situation that needs to be resolved immediately. Where there is an urgent situation or somebody's calling with that's fallen into homelessness or is about to be, that they are then triaging that information to the regional access points, and that they're providing that basic data entry into HMIS, so that now we've included that household as somebody within our total universe of folks who are experiencing housing instability or homelessness in the community. So 211 plays a critical role in particular because it's accessible geographically to anybody in the state. The limiting factor is that folks may need a phone, but where our regional access points and assessment partners tend to be congregated in certain areas, our outreach teams are working hard out throughout the community, but have limited capacity and staffing. 211 becomes that centralized spot for anybody in the state to call and at least get a base level of resource connection and base level of understanding of who they are and what their needs are, and then moving them into that next step in the process. So our 211 system acts there and often linking to our regional access points. And here are, I think it is 9 of them or so, the regional access points throughout the state. If you are a regional access point, I think you would know that, but you tend to be the larger organizations in some of the areas here listed, and you play some really important roles. You're the point of entry for people who are experiencing homelessness coming in from 211 or who are referred directly through into an access point. That may include in-person and walk-in or virtual support. That includes that diversion and housing system navigation, assessment. I think all of the RAPs are also assessment partners. You're looking to match openings with local prioritization policies. One thing that is unique in New Hampshire is because we are, especially the balance of state is statewide, we have different geographies. So if you live in the Keene area, the types of resources and local connections that are available look different than in Manchester or Portsmouth or Wolfboro or up in the North Country or wherever it might be. And so you have that local knowledge and coordination of services within your local community that may include internal and external case conferencing. In terms of timeframes, what the expectation is, as individuals are referred from 211, that there's follow-up within 24 hours of receiving that referral, and that you're following along the similar timeframes for the diversion conversations and then the longer assessment and HMIS data entry that our assessment partners are doing. So you as a RAP are a subset of our assessment partner group. Our assessment partner group is a wider net of organizations and entities that are able to do assessment, to get those folks into the system, to work on these diversion efforts. The RAPs are a centralized place where 211 is going to be able to refer into or provide information regarding, and then other folks may walk in. Some of the organizations on the list are clearly our local shelter system, are clearly the primary service providers that homeless folks are engaging with within the community. And so you're performing a lot of the same tasks that the assessment partners are performing, but also having that point of entry for 211 or other folks who may need a referral within a community, that the regional access point becomes kind of a centralized space for that. In order to access our regional access points, we also have our outreach partners. Many of you or some of you on the phone may do outreach in the community as part of your program. Maybe you run a small community-based program where you are doing outreach and connecting with folks who are living outside or in their cars or in places not meant for human habitation. As far as the formal list of outreach partners that's listed here, you can see them across the state. But really, anybody who's doing outreach should be part of this consortium of groups that are proactive. And I would suggest, this isn't part of the slide, that our outreach teams are mapping what your outreach activities are doing, where they're doing those activities, and for whom. What groups are you looking to identify in your outreach strategy so that we can best streamline and not duplicate our services. One of the things that I see in communities across the country that has the most duplication of effort is outreach, where there are outreach providers from different funded programs that are all in the same space, not sharing information. And I'm not suggesting that's happening in New Hampshire, but it's always something I suggest is that literally, I think the 15 folks on this list here should virtually or in person get in a room with a map of the state of New Hampshire and figure out where they are, when they're there, and who they're looking for, to make sure that we can be as efficient as possible, share that information as easily as possible, so that we can maximize the limited staffing and capacity we have for our outreach activities. So our outreach providers are, from this perspective, in terms of the formal system, are receiving emergency solution grant or PATH funding. Many of you are, and if you are, you must participate in that assessment partner system and utilize that court entry system. You will be entering folks into the court entry project in HMIS at the time of entry into either ESG or PATH. You also are expected to follow households that are entered into court and entry at least weekly. So you can see there's a lot of similarities here from our outreach team going toward our assessment providers, right? So our assessment partners are the broadest group that we have. Within that assessment partnership group, there are the regional access points that are sort of centralized location. Then we have our outreach partners who are physically out in the community, engaging with people who are living outside or are touching spaces outside of sort of central service areas. And the same timeframes around diversion and assessment and completing HMIS data requirements are important here. Again, as we go through this, a reminder to all of you who are not listed on these slides, the continuums encourage and really do want you to participate in these processes. And if you're looking at the different different expectations across these, so if you do outreach and you are not connected to this system, it's part of a mission-driven organization that you are working for, and you sort of do it on your own. States and the COCs really want to work with any provider who has some capacity to participate in this, even if you don't have the full capacity necessary to meet every expectation laid out here. Particularly if you're not funded by HUD and you're not technically obligated to participate, it doesn't mean that you shouldn't from a philosophical and sort of system planning point of view, but also that if your limited capacity is the concern that you have, making sure you communicate that with the COC leads or your counterparts locally to figure out where can you fit in, how can some of your capacity issues around HMIS or assessment be relieved by, say, the regional access points or other places within the system, so you can still do the great work that you do as a mission-driven organization, but not necessarily, and still be able to participate in coordinated entry and balance those two priorities that you may have while being part of this system. So our outreach providers play a really critical role. I just want to shout out to, I think all of us and all of you in particular have some of the hardest jobs in the world. And I just really have to give kudos to the outreach providers on the line who are really outside. You know, we're coming into mid-December right now. This is a really difficult time of year. It's a really difficult job. And I personally, as somebody from New Hampshire who is not a direct service provider, appreciate your hard work. And I think it's always worth elevating our outreach providers because I think it's one of the hardest jobs in the world. So we also have our emergency shelter system, right? I'm just gonna take a sip of my water here. So these are the primary emergency housing or emergency shelter providers across the state. Some of you may provide, again, this is another opportunity for small or faith-based or mission-driven organizations that are not formally part of this to engage with your continuum of care to figure out how your emergency response and services are able to fit into this system. How can the clients or the people that you are serving be referred into the more formal process that might lead them to a housing intervention? How can the system understand when you have availability to put somebody into an emergency housing or emergency shelter bed if there's no other place for them to go and you have room? How do we make that work together? But these are the primary shelter providers. So there are certain agencies, and you know of yourselves, that must participate as a provider within the court entry system. Shelter guests are required to be entered into HMIS, the HMIS court entry project by shelter staff. Shelters need to inform 211 of any updates to how your shelter is functioning and referring. So we want to make sure that 211 knows who can and cannot go to your shelter or where you're at capacity or have further capacity to take more people in. We know capacity is very limited right now. I know in our area, they're going to be opening a warming center. But it's important for 211 to understand that, because the worst thing that we can do to people in a housing crisis is give them information that's incorrect. And so if 211 thinks that the shelter down the street is open but you closed, or has space but you don't, or allows people with pets but you don't, then they need to know that. They need to understand the restrictions and the caveats of how and when you receive referrals, so that they're not providing false information to people and sending people on wild goose chases who are already, again, in the worst day, week, or month of their life. So shelters are not required to fill openings through the prioritization list. Court entry is about understanding the finite resources on the back end. But we do want to make sure that where capacity allows, that we're continuing to provide those diversion services. Most of you are also assessment partners, continuing to look for other local resources that may be available to people. And you would be part of that court entry partnership agreement. And again, going back to important timeframes and HMIS data requirements, we're still within this larger universe of our assessment partners. Your shelter providers are also doing those diversion and problem solving conversations. You're also going to be doing the formal assessment that puts somebody onto the prioritization list. And again, that prioritization list not meaning that that person, that household is going to receive any sort of housing service, but that they would be on the list to examine their vulnerability as compared to others in the community to figure out who gets that next. Shelter providers, I would encourage to be exceptionally transparent with 211 and your community partners about what you do and do not allow and how you allow people to come in. I would also encourage, because I have the soapbox for the minute, that if you are an emergency shelter provider that does not, that creates barriers for people to come in, whether it be that they have to show, that they have mental health treatment, or that they can't be under any form of substance use, or that, you know, they can't have a criminal history if they have to pay fees to you. We have to remember that emergency shelter is the last option for people, and that the people who end up in emergency shelter are often the people for whom other systems said no, and our system needs to say yes and bring people in. So we won't dive too much into emergency shelter today, but I'm always a bit disappointed in other communities, probably not New Hampshire, with how emergency shelters have become a really difficult housing niche that screen more people out than in the hardest days of their lives, especially in the winter. So with my soapbox, I will say that I think we have to completely lower the barriers to shelter to the point where we can do so safely, and get back to the roots of providing what is the most basic of human rights services that we can, even to folks that may be challenging to work with, as long as they can be safe in that environment. So finally, we need to house some people, right? So we talked a lot about assessing them and doing these other things. We also need to house folks in the community with the limited resources we have. So here are our formal housing partners that you can see. Again, these slides will go out and we'll have an opportunity to take a look at them together. But these are the partners who are operating, or at least formally operating within the system, our permanent housing resources, whether it be permanent supportive housing, POPWA, rapid rehousing, ESG, things like that. Some of them may be specific to veterans, or specific to youth, or specific to families, or specific to individuals, but these are our housing partners. And these are the folks that are receiving those referrals from coordinated entry from that prioritization list to fill open vacancies with eligible clients. So the whole process that happens prior to this about trying to find alternatives, about making sure people know where they can go for emergency support, to doing longer form assessment to understand people's needs, vulnerabilities, and glide path options out of homelessness, to the triage function, trying to make a distinction between broken arms and head trauma, results in us coming up with a small group of individuals on an ongoing basis for whom, when a housing unit or opening becomes available, whether that be an enrollment, say in rapid rehousing, where they're enrolled prior to their housing placement, or permanent supportive housing, where there's more of a rapid connection to the unit, you are pulling from that prioritization list. So if you are a housing provider and you are only providing housing to the people within your organization because you also run the shelter or the food pantry or whatnot, then that is not consistent with what we're trying to achieve with coordinated entry. Because again, it's not about my client, it's about our client. So just because you may have folks who you're serving in other capacities or interacting with who seem vulnerable and really do need the housing, provider across the street or across the town or one town over, maybe working with somebody who's in exceptionally greater dire straits and needs that housing more quickly or has higher vulnerability. So our prioritization list is a community list of individuals and households for whom we've identified needing the most and most immediate support for housing interventions. And as a housing provider, you are required to pull from that list. And that means if you're doing permanent supportive housing, you need to be prepared to take the hardest clients that exist within our community, or the clients for whom we have yet to understand how to serve best within our community. There should not be a denial of services for permanent supportive housing. If you are a PSH provider, you have opted into serving those clients with the highest vulnerability and most significant housing barriers, including physical disabilities, mental health, substance use, criminal backgrounds, low income to no income. That is your job. Similarly, for rapid rehousing, if you are a rapid rehousing provider, you need to make sure you're operating with the greatest flexibility that the federal government and the state governments allow you to operate your projects to meet the needs of highly vulnerable people for whom PSH is not available. Rapid rehousing is not a 1-month program or 2-month program where you give a security deposit, print off some Craigslist ads, and pay 2 months of rental assistance. What we have to continue to do is make sure that our housing programs are meeting the needs of the individual households in our community. So again, this is soapbox, but from the housing provider point of view, really understanding how much flexibility you have within your program and what your program is specifically designed to do. COC programs are designed to meet the needs of the most vulnerable people in the community. ESG is the same way. HOPWA for a specialized population. If you are denying services to folks because they are too quote unquote high barrier, or they have too many problems, or they're too vulnerable, or too hard to serve, then this may not be the role that you meant to sign up for. And I don't mean to say that in a mean way, but across the country, again, never in New Hampshire, we hear of PSH providers who say, I can't serve this person because they have a criminal history. Well, I'm sorry, you signed up to serve that person specifically because they have a criminal history, specifically because they have substance use issues that lead them to housing instability, specifically because they have unmet and untreated mental health needs that they don't want to get treated right now. And your job is going to be help stabilize them within that context. So that is the soapbox on our housing providers and the fact that we have a lot of people in the state of New Hampshire that are probably easy to serve. And we need to make sure we're focusing likely on those folks who we might frame as hardest to serve. And I would frame as those who we have yet to discover the best way to serve. Important timeframes. We need to make sure if we're going to link people to your housing resources that the court entry process knows that you have openings. You should be able to let the court entry lead know, and I apologize for my cold, by the way. I know it's loud when I cough in the headphones. Provider list of openings to court entry on a weekly basis. And I would suggest if you know somebody is going to be leaving their housing, or that a unit is going to be opening up in the near term, to let them know as far in advance as possible, because that gives them, the court entry leads, their knowledge. They need to anticipate what might be available, not just tomorrow, but in the coming weeks. Also making sure that those referrals, once that referral is made to you, that you are then taking on some level of responsibility and connecting to the individual or household, maybe through the referring partner or the assessment partner that they originated from, to try to bring them, screen them into your program, and to follow up with the outcome of that outreach and referral within 24 hours. So in HMIS, you're going to update that court entry referral to indicate the outcome that they've been referred, and then you would exit the client from the coordinated entry project, because now you are entering them into your housing project. So for those of you who don't use HMIS, the court entry project is separate from a given project or program, housing program. So once somebody is becoming housed, they're exited from coordinated entry. They no longer exist within the community, the universe in our data set. They are now going to housing program. Of important note, just because somebody is exited from HMIS court entry project doesn't mean they're necessarily exited from the larger systems effort to ensure their housing resource is available. So for instance, we saw this with some of the extra vouchers. We know this exists in the veteran community. You may have folks that go into rapid rehousing that really would have been better off going into permanent supportive housing. Permanent supportive housing wasn't immediately available, so we housed them with rapid rehousing. In rapid rehousing, they maintained their eligibility to transfer to permanent supportive housing. And therefore, you may have folks that were housed with rapid rehousing who have high levels of vulnerability, who need the more intensive permanent services that PSH brings along. And you may need to bring the case conferencing or communicate the need to transfer somebody from your rapid rehousing project into a permanent supportive housing project, whether it be COC or even VA funded. Folks exiting HMIS coordinated entry project does not then preclude them from going through a discussion within case conferencing, within the prioritization policy that allows for those transfers to happen. I know there's been some effort around these transfers with some of the emergency housing vouchers or some specialized vouchers that came out last year. I know my VA friends on the phone and SSVF friends on the phone have done this for quite a while, where they're able to house people with SSVF and then continue to look to see if HUD-VASH might be available. So just because someone is exiting out of HMIS in the court entry project does not then mean the system has now deserted them. Should their needs change or increase or shift while they're housed in one project, that shift in need or that requirement of trying to explore other long-term options can still be in place. It just doesn't exist inside that core entry project. And the same goes for folks that may go into rapid rehousing or even PSH, and you're trying to get them referred into public housing. Maybe they don't need the services, they just need the affordability. But just because someone is leaving the court entry project in HMIS does not mean the system has forgotten them or you as a housing provider. It just means that they're no longer part of our universe of actively homeless people within the state of New Hampshire or within your community. So that was a lot, and I see the chat's been kind of lighting up a bit here. I wanted to leave at least 10 minutes, and it looks like I left 11, which is impressive for me because I talk a lot, to see if there are questions, clarifications that have come up, Stephanie, in the chat, or other folks on the line from COC leadership or the court entry committees that would like to chime in. And I will pause and take a sip of water while you let me know there, Stephanie.
Thank you, Doug. I did just want to highlight, if you are interested, the chat has me thinking, if you're really committed and interested in being part of how all of these policies and procedures are developed, what we're doing with assessment, if you want to have your voice at the table as we continue developing all these things, because mind you, coordinated entry, it's not a one and done thing. Our system is always looking to improve. We're always looking for feedback, how we can make this better, because again, the goal is to help prioritize those who are most vulnerable in our system. So we definitely need to hear from all of you on that. So if that's something you're interested in, all three COCs have coordinated entry committees that meet to discuss these items and are the leads in each COC for making these decisions and policies and all that. So I think most of you on the call are already quite involved, but if you're not, please feel free to send me an email. I'm happy to direct you to how to get in touch and involved in that stuff. I think most of the questions and comments in the chat have been addressed through the presentation in the chat. 211, thank you again for all the support. Helpful to see you in the chat as well. Let's see. The last question here from Jim: if people in coordinated entry are housed and then they become homeless again, do they stay at the top of the prioritization list? So as Doug kind of mentioned earlier, that list is not the same day to day. That list is changing every day, based on who's coming in, who's coming out. So there's no, nobody is staying at the top of the list per se, regardless of what the situation. It's pretty fluid. It's always kind of moving depending on what's going on in the community, what's getting entered in for data and all of that.
I'll add to that, Stephanie, really quick.
Yeah.
So a couple things on that for folks who become homeless again. One thing that we did not talk about in this training, but will be part of, I think, future conversations, and we actually did a training a year or two ago, is around case conferencing one, where we look to build in some sort of transparent process that allows folks to communicate needs that are not captured within the formal assessment process to the court entry kind of team or group that allows sort of supplementary information that might warrant somebody being prioritized that might not look the same on paper. I think we're still working on kind of what does that look like, more formally. I think that's happening probably in many of your local areas already. But that idea of case conferencing. The other piece is one of the only predictors of homelessness is whether someone has been homeless before. And actually, when we do prevention work, that is one of the heavily weighted predictors around, who is not just going to lose their housing or get evicted, but who's actually become literally homeless. One of the only research-driven predictors, there's a number of them, but one of the primary ones is who's been homeless before. So as we think about the new assessment tool process and a new assessment process that's sort of being developed now, and we'll talk more in training, that idea of elevating folks or weighting vulnerability based on a recent experience of homelessness or recent re-entry into homelessness is something we can certainly take a look into because poverty does not predict homelessness. There's lots of folks in poverty that don't become homeless. There's alcoholism, plenty of alcoholics in housing. Mental health, there's plenty of people with mental health issues in housing. But whether someone's been homeless before in the past actually has statistically statistically, it's a better predictor of whether someone will be homeless again. So when we see people recidivate from program to program and not be able to keep their housing, it is a case conferencing issue. It is a prioritization issue that we'll hopefully be able to address a little bit better in some of the assessment tools. And I think it's also a communication issue amongst the housing providers, like what happened, right? So there should never be an exit from permanent supportive housing. There could be an eviction, but they shouldn't be exiting from the project. They should be rehoused somewhere else and provided some different level of service. So where folks become homeless again, another element to that is what didn't work last time and how can we better support their housing stability within the sort of context of their specific vulnerabilities moving forward. So really important point, Jim. I don't think it's sort of fully resolved at the moment, but certainly something that we can keep an eye on as we kind of continue to build this out.
Doug, that's everything we have in the chat left. Let's see.
There's one last question, I think, on HMIS there, Stephanie, that just came in.
As a referral partner, how do we ensure our clients have been enrolled in coordinated entry? All of this system is big on communication. So where referral partners aren't necessarily, they could have HMIS access, but they're not doing the assessments. And it's really those assessment partners and the regional access points doing it. It would be to communicate with whoever that is that you made the referral to. 2-in-1 is making sure that people are getting referred to the regional access points. I haven't heard of any issues so far, but we're always open ears. I believe all the regional access points are doing a really great job at following up on those referrals from 2-in-1. So, if you do make a referral to 2-in-1, you can be ensured that they're being referred to the regional access point. And as Freeman mentioned in the chat, you can reach out to your regional access point. I can include in the email that goes out with the slides and the link for today's training, what we currently have for the list of regional access points. That will give you what the walk-in hours are and places, and let you know who those folks are that are responding to the 2-in-1 calls. And if you're a referral partner and you're not sure who to send a referral to, connect with me after the training and we can make sure, but this is still all part of the process that we're trying to build and really get up and running pretty well. So we'd like to have some more discussion on how we formalize the process for referral partners to get their clients integrated directly.
Yeah, and to add to that, Stephanie, at least for Belknap Merrimack Community Action, we are currently the regional access point partner for that area. So honestly, we're just trying to make it as easy as possible. And like she said, as this gets formalized, it'll be easier because we'll all just know exactly what we should do and when. But until then, please just reach out, at least if you're in my 2 counties, or even if not, please just reach out to us. And I'm sure I can say for other organizations that we're all happy to help you connect with the right place to get it done for your client, because that's what it's all about. So feel free to reach out to us.
And 2-in-1 is a pretty easy number to remember. So if you do have someone that needs to be connected, that there is no wrong way you can go with doing the 2-in-1 referral. They've been an amazing partner, really good at getting these housing referrals out.
Yep, they're rock stars. They get them over to us, and we couldn't do it without them. So thank Thanks, Joe and Melina.
Okay. I'm not seeing anything else in the chat that has not been addressed yet. Looking at the time, it's 2:27, just a couple minutes left.
Just a reminder, if there's any final questions, we have 2 minutes, but we will send the recording out of this presentation as well as the slides. And I think to Freeman and Stephanie's most recent points here, communication is key. We've got bullet points and whatnot here, trying to create kind of a more formal and clear way in which we help people navigate towards services. But we're not a huge state. A lot of us know each other, right? And so, communicating with your local partners, asking those questions of the continuum of care leads and court entry leads can only help. And creating feedback loops to make sure that what's being put in place is going to best meet the needs of the community. We're small but mighty here in New Hampshire. I think there's a lot of good opportunity with everyone here on the line to really continue to enhance the services that are already in place and look for ways that we can work with each other most effectively on behalf of and with the people who are in a housing crisis and need to be supported. So, many thanks to everybody, but keep up that communication because it's incredibly valuable. Anything else, Stephanie, before we close out?
Just wanted to remind everyone that our next training is going to be focused on access and assessment. It's currently scheduled for Monday, January 10th, 1 to 2:30. If there are changes to the schedule for some reason, we will communicate that with you, but currently that is what we're looking at. I will also include, as usual, in my email, the list of the upcoming trainings we have scheduled. We really appreciate everyone participating and coming, asking us questions, and it's been really great so far. So we look forward to continuing the series.
Thank you, everybody. Thanks, Stephanie, for organizing this, and Freeman for bringing your thoughts in here as well and helping out with this presentation. For the rest of you, happy Monday. If we don't see you or talk with you, or at least for me, I hope you have a great holiday season. Happy New Year. Stay safe and healthy. And we'll all be talking again in the future. Thank you very much.